Guys, respectfully, what are we doing? I think one of the hardest parts of teaching nursing students is trying to explain to them why we have these standards of care in healthcare. We really try to drill it into their heads that there is a correct way to do things when you're a licensed nurse and when you get out into practice. And then when we're at clinicals, sometimes we go into post conference and there's an instance maybe that the nurse didn't wear gloves all day. What? I'm sorry, what? So obviously, this is very confusing to them, very conflicting information, and they start asking very valid questions. And I am scrounging in the background, trying to figure out a way that makes sense why they would see this in practice, and maybe that this nurse has been in practice for 37 years and they just fear nothing anymore. And let me just clarify before you get too defensive, this is not a situation in which it's like touching a patient's shoulder or adjusting their blanket. These are situations where gloves should absolutely be gloving. Like, please understand that nursing students are just trying to do exactly what they're supposed to all the time. And honestly, when these situations happen, it's a conversation and a lesson about basically sometimes you're going to see things that are not what you're supposed to be doing. And that in itself is a good lesson to learn as a student, especially.